versatility that you guys have implemented in your software. And that's what I think sets your software apart. And you've done a really good job with that. If they understand that, I don't think they would. Every case is different. Every implant case, you know that, every implant case is different. And if you have a guide system that locks you into a specific way of treating that case, that's not good. You need to have a guide system that has the versatility to let you treat that patient any way you want to, but do it guided, right? And that's what I teach the residents. I say, you have to look at the case, make a decision as to which way you're going to go. Is this a dual scan case? Would it be more advantageous to do this case dual scan? Does the patient present with a denture that is well relined, would make the workflow go well to do it dual scan? Or is it a partially dentated case where the workflow would be better to optically scan a model and do an STL merge? And I think that's what sets you guys apart and makes it a very, very nice piece of software. I'm excited to see that. You've done the speed at which you're developing the software is also impressive. When Mark said, I'll find things because I've played with Blue Sky, SciCat, Simplant, Nobel Guide, Nobel Clinician, you name it. I've used it and used it clinically. But so when you use that many different software programs, then as I'm going through your software, I go, but it's missing this. And then I'll call Mark, and Mark will say, well, that'll be ready next week. So it's already been identified, and then next week, there it comes, which is really impressive. Very, very impressive. It's easy to use. I mean, it's easy to use. It's intuitive. And it's just a really nice piece of software. And the residents, if you can get, I don't know if you've been in the United States long enough to understand the dynamics of an oral surgeon, but oral surgeons, it's difficult to make an oral surgeon sit in front of a computer and do a lot of clicks, right? Surgeon, it's difficult to get them to sit and learn. Primarily, that's the stumbling block.
The learning curve.
The learning curve must be very rapid. And so your software has to be intuitive. And when I sat my residents down and I went through it and said, these are the steps, they understood it and went through it very quickly. I got one of the residents was tasked with giving a lecture to the Tennessee Oral Surgery Society. He's going to do his whole lecture on your software and the versatility of the software and the ability, the difference between selecting a case for dual scan and STL model merge, and what's the benefit of segmentation and things like that. So he was very impressed by it, and this is a resident who had used Nobel Clinician for 2 years. And Nobel, as you know, Nobel Clinician, they've done a good job with this latest version of their software too. But then there's gaps, right? There's gaps in the software. If you lock yourself into a dual scan software, then then there are a lot of things that you can't do that you'd like to do. Good, yes. The guides have been, our experience with the guides have been spot on. I mean, we had one guide, our first guide that we got, we second guessed the guide because it looked like it was, the angulation was a little off, and I told the resident, I go, you never should second guess these things because they'll, we need to, but we did do our pilot drill and took a PA just to check, and it was right on, so, but it is easy to, because your perspective sometimes can be different if you're looking at it in your hand and versus looking at it in CAD/CAM, versus looking at it
Inside the
clinically
patient's
in a
mouth.
patient's mouth, which is why that's the whole benefit of guides, right?
Exactly.
Because I don't care how talented you are, when
When
you
you
flip
pause
the
the
patient
perspective.
upside down, you're looking at the patient upside down.
Exactly.
No matter every perspective that you look at the patient looks
the same.
is different. Well, it's different unless you have a guide.
Exactly.
Right. And so having the guide lets you close that gap.
Great.
I like it.